Speaking with State Senator Michael Moore about what's happening in our, we've been talking about the economy, of course. It does seem as if jobs is number one. What's your take nationally on this whole health care? I mean, people, they call it Romney care or they call it Obamacare, depending, I guess, on what side you're on or who you kind of want to go after politically. Is it working in Massachusetts, do you think?
Yes, it's working as far as coverage. And the amount of 97% of the public is covered now with health care. The problem that we have to address is the cost. And that's why, getting back to a previous statement, that for small business, one of the plans that we have will address the immediate cost. If we can pass the affordable health care plan, it will, from the industry we're getting, it will reduce costs by 20% during this spring. But that's what we have to look at in Massachusetts, is the overall. The costs have not subsided. We're still seeing 20% increases on health care, and that's really what we got to control. But the actual, as far as people being covered, that's been very successful. In one or two seminars that I've gone to regarding the national health care, 3/4 of what's being proposed, Massachusetts already exceeds.
Really?
So, yeah. So if whatever they pass, we're not going to have a big dramatic overhaul of the system we have, because we already exceed 3/4 of it. But the problem, one problem that Congress has, is they're not explaining the plans. We've still got a Senate plan, because I have people asking, do I support it? I said, well, I don't know. You got a Senate plan, you got a House plan.
What are you asking me,
there's still not one plan yet.
Yeah.
And one thing I think they could do, just to simplify it, portability. Just pass a portability clause. Look at some other things, but that allows the sale of insurance across state lines. I think that would help reduce costs.
Yeah. I think everybody seems to agree on that.
Yeah.
And it does seem as if, why can't you get maybe just that one thing done? I understand where the Democrats are coming from with, we don't want to do it piecemeal,
right.
But it does seem as if everybody agrees exactly on that, and the public certainly wants that as well. Before we let you go this morning, it seems as if we've been talking about this issue every month for the last year, the casinos, but it is back in the news again from the House Speaker now, and he wants to see some extended gambling bill, and what exactly is he looking for?
But he's added some complications to this now.
Yeah.
Because he's looking at the racinos.
Casinos, exactly.
Which, again, and honestly, I don't know what the majority of the opinion is in the House or Senate as far as the racinos. Personally, I have some angst with it, with the fact that I don't think it's going to produce a lot of jobs.
Right.
I mean, they're claiming that I think it can bring in $30 to $40 million immediately. Well, that's great, but where's the long-term jobs? At least the resort casinos, you've got the trades, the contractors, they're working, they're building an infrastructure.
And what we've talked about in the past is you were thinking, or you'd like to take a look at that $1 billion proposal, build a $1 billion casino, maybe it goes in Palmer, maybe, wherever it ends up, but start with the one. Start with the one, not two. Right. I mean, if you build two and it's not successful, now we've got two blighted areas. How do you make up for that now? Now it's going to cost us $5 billion to rectify it? And it can't be a cure-all, because we're seeing, that Vegas seems to be in trouble, and in Connecticut it doesn't. Yes. The biggest casino in the world is in trouble. Has laid off, 800 workers in the last several months. Well, and if we look at Foxwoods or Connecticut, they started off with one. They started off with Foxwoods. Right. Then they went to Mohegan Sun. Then they've now with MGM's down there. They've done a gradual. They just didn't go in there and construct two large resort casinos. Right. I mean, it's great if we can get the infrastructure built, but long term, if it goes the wrong way on us, have we made the situation worse for us? I think the only other thing that has really been in the news that we can touch on real quick is just that driving bill. Stop texting in the car. Yes. And the senior driving piece. Right. Yes. Yeah. So that actually that was. I don't know if the governor signed it out yet, but that went through the Senate last week. Well, actually, I think that it's got to go to a conference committee, because they had a total ban and we just banned the texting. Right. We're still allowing for the cell phones, and for the senior aspect of it, the registry piece. Our bill, 75, you've got to get tested 5 years after that. But the test is not, then at 80 again, then after that it's every 3 years. But the medical or the physical exam in the Senate bill, rather than if we have your own personal physician doing the exam, the registry develops the criteria. You go in, a certified doctor or a medical professional will review the form and ensure that you meet the criteria. Where the House bill calls for someone from the Registry of Motor Vehicles to conduct it. And I don't know about you, but personally I would much rather have a medical professional. Yeah, right, exactly right. State Senator Michael Moore, thank you for stopping by. That's my pleasure. Thanks for having me again. Ran through, I think,